Hello everyone, good evening to all of you. Today we are back again with another interesting session with Dr. Vishakha, and this session is in collaboration with HHF proudly, and this is the another gemstone of the webinar series that we are having with Homeopathy 360 Peace Beyond Boundaries. Now it's time to introduce our today's speaker, Dr. Vishakha, an ardent homeopath with over 15 years of rich clinical experience. She has graduated BHMS from Purushottam Das Bangla College of Homeopathy, Chandrapuram. She was introduced to Mind Method HHF from 2016 onwards and started practicing applied Mind Method. In Vital Vibes Homeopathy Clinic, she has treated many health issues, including both chronic and acute conditions, such as pediatric health issues, women's health, respiratory issues, gastric, and whatnot. From last 6 years, she is successfully managing a polyclinic, especially for lady doctors, named as Synergy Polyclinics in Palwa, Dombivli. She has been a speaker at Dombivli HHF, recently has been recognized by HHF for her contribution in homeopathy. And today we have a very interesting topic, that is pediatric case of cervical lymphadenopathy. And a very, very warm welcome to you, ma'am.
Thank you so much, Dr. Mansi, for such a wonderful intro. Such a wonderful platform you have created for sharing and learning homeopathy. Very, very
Thank you.
grateful.
Thank you so much, ma'am.
So, let's
So,
start.
ma'am, yes, ma'am. Let's start. If you want to share your screen, there is a share button.
Yeah.
We would love to learn from you.
Oh, first of all. You able to see my screen visible?
Yes, ma'am, it is visible. Can you, ma'am, do it in the full screen? I guess it is in the full screen.
Sorry, I can't hear you.
Ma'am, is it on full screen?
Yeah, full screen.
Okay, ma'am. Please begin, ma'am.
Full screen is not visible?
No, ma'am, it is visible.
Okay.
Yes.
Okay. So, very good evening, all. So, first of all, I just want to thank Dr. Mansi, Homeopathy 360, for having me here today. And thank you, HHF and Dr. Pallavi Chaturvedi, ma'am, for giving me this opportunity. Am I audible? Am I audible?
Yes, ma'am, you are audible.
Audible, right? So I just wanted to say a few words about HHF, how I came to know about HHF when I joined. So I was practicing homeopathy before also. But in 2016, I came to know about the mind method. And I just started attending those offline webinars and discussion sessions, and was very much impressed about the way they teach us, or they all studied together. So since then, in 2016, I also started with my journey in new journey with homeopathy in HHF. Okay, so today we're discussing a short case, a pediatric case. So let's start with the case. First of all, gratitude to Master Samuel Hahnemann for giving us such a wonderful science. We will always be grateful. Gratitude to Mahagurus, Dr. Mohanty sir, Dr. Milind Rao sir, and Dr. Gupta sir. These are all my mentors in HHF. Gratitude to them. Each and everyone has a unique way of teaching. So they taught us homeopathy in a very different way. Grateful to them. And this is all my HHF family. We got to learn so much from each other. Gratitude to them too. Let's begin a case now. Screen is visible. Could read the case. Dr. Mansi.
Yes, ma'am, it is visible.
Visible, right? Okay. So let's go to the main case. This is case of a 5-year-old boy suffering from recurrent cold and cough and fever since past 1 year. Every time he gets cold, cough, fever, he had to take so much of medicines, but those things relapses again and again. Okay, so this was a referred case actually, and this was on VC. Okay, so when they called me, I just asked them, how can I help you? The kid is just 5-year-old, so his mom, as attendant, spoke to me. She said, 15 days ago, he again suffered from a fever. Why she was again means it was used to that he is suffering from fever every few days. There were frequent bouts of vomiting and so severe. This time it was so severe that he has to be hospitalized for 2 to 3 days. So he took discharge from hospital, and after coming back home, after 2 to 3 days, what happened? His mother saw a lump near the neck, right ear. So she was a bit, what happened kind of, and she again went to the doctor. She took the medicine for 1 week, but again, the lump remained the same. It didn't go. Okay. So you want me to explain in Hindi? Hello? Okay. If anything, please do let me know. So the mother was telling that I thought of taking homeopathic medicine as we have already been given him allopathic medicines and antibiotics since last 1 year. So then she told doctor, he doesn't eat enough. He is weaker than the other boys of his age. Okay. So as I already told that this was in VC, then when the mother was talking to me, that 5-year-old kid was busy in riding, I could see him riding the tricycle in the house and making noise around the room. No? So mother also was looking in between while talking on the VC as to what he is doing. कि यहाँ टकरा जाएगा वहां टकरा जाएगा पता नहीं कहाँ सर फोड़ लेगा. So this was the kid we could see on the VC. Okay. So while we were on the VC, mother called him to come and talk to doctor. So first he didn't came, and then he came. He came. As soon as he came, he put the earphone and he was talking to me. He was alert that someone is there on the phone. He looked at me. I said, "How are you? आपका नाम क्या है?" He was answering, but सारा ध्यान ना उसका वो जो ईयरफोन है, ही स्टार्टेड प्लेइंग विद दिस ईयरबड. He was answering and playing with the earbud at the same time. Okay. So just he answers those two questions and again he ran back to his cycle toys. Mother kept calling ki aa jao, but then afterward he didn't came. Okay. So I again continued the VC with the mother. Then I asked her, tell me more about her. So what mom told was, he does not complain of pain. Means the cyst he was having, na, he is not complaining of that. तो उसका सारा ध्यान, व्हाट शी टोल्ड वाज, उसका सारा ध्यान तो खेलने में ही रहता है. खाता पीता नहीं है, उसके तो पीछे ही पड़ना पड़ता है. दिस वाज द मदर्स वर्जन. नाउ आई आस्क्ड मदर कि ओके ठीक है, अभी तो ठीक है, बट जब बुखार होता है, व्हेन इन फीवर हाउ इज ही. सो मॉम टोल्ड, when in fever he just lies down calmly, he play with his toy on the bed or watch the cartoon lying on the bed. Okay. Whenever fever gets down, whenever he feels better, he get back to his masti and he takes medicine. He never says no. We only feel bad as to he has to take so much of medicines. Hmm? So as I told you, this was a referred case of one of my patient. She is an aunt of this 5-year-old kid. Okay. So what I did, I also got some information from the aunt. Let's see what she has to say. So this is the VC between me and the aunt of the kid. So I asked her, tell me more about the patient. सो शी टोल्ड, बहुत ही प्यारा और नटखट बच्चा है, बहुत मस्ती करता है, बिल्कुल परेशान नहीं करता है, सबका कहना मानता है, उसको खेलना बहुत पसंद है, सारा सारा दिन खेलता है, जो भी दो खा लेता है, बहुत ही गुड बॉय है. तो सी हियर व्हाट हैपेंड, मदर एंड द बुआ or the aunt is giving the same information. So I got to go a bit deeper. So I asked कि any incident that happened 1 or 1.5 year ago. So what she told na, sorry, that the patient's grandmother has been bedridden and ill since 1.5 years. सो क्या होता था ना, ये 1.5 साल से उसकी ग्रैंडमदर जो बीमार है ना, उनको देखने के लिए उनके घर पे बहुत सारे रिलेटिव्स आते थे. फ्रीक्वेंट विजिटर्स होते हैं ना रिलेटिव, तबीयत देखने के लिए कोई विजिट करता है, दैट सॉर्ट ऑफ. सो क्या होता है ना, इन अ कैजुअल टॉक जैसे आता है बोलते हैं, तो बहुत दुबला पतला हो गया है, कुछ खाता पीता नहीं है क्या, इसकी तो हाइट भी नहीं बढ़ रही है. सो ये जो कमेंट्स रिलेटिव्स की तरफ से आते थे, दिस यूज टू अफेक्ट द मदर ऑफ द पेशेंट. मतलब बच्चे की माँ को ये सारी चीजें अफेक्ट कर रही थी. एंड शी स्टार्टेड, ये बहुत रिलेटिव से ऐसी बातें सुन के ना उसको ऐसा लगा कि सच में मेरा बच्चा कुछ नहीं खा रहा है या कुछ. तो शी स्टार्टेड गेटिंग बिहाइंड हिम, एवरी स्मॉल थिंग, फॉर एवरी स्मॉल थिंग, खाने पीने के लिए, खेलने के लिए, बहुत उसके पीछे ही पड़ जाती है. तो ये भागता रहता है इधर उधर, सुनता नहीं है. वैसे ही इज अ गुड बॉय, सबकी बात सुनता है, तबीयत ठीक खराब रहे तब भी ज्यादा कंप्लेन नहीं करता है. बस उसको खिलौने मिल जाए, कार्टून देखने मिल जाए, एंड ही इज वेरी हैप्पी डूइंग दैट, ही लाइक्स दैट. ये सब जो इन्फॉर्मेशन है वो उनकी आंट दे रही है, पेशेंट की आंट दे रही है. सो दिस वाज द केस. Anyone want the case to be said in Hindi? Any doubts about the case? Dr. Mansi? Any doubts about the case? Dr. Mansi?
No, ma'am. Till now, we do not have any doubt. We can proceed and we'll have the doubt session in the end.
Okay, sure. So let's go ahead with analysis and evaluation. See what happened now. This is a pediatric case, a 5-year-old kid's case. In this case, actually, kid will not be giving you any information. So the source of information will be his IPR or the attendant. Okay. So in this case, I got most of the information from the mother, some from the aunt, and most of the time, 90% information was obtained only by observing the patient as to how he is behaving. Okay. So, first, let's see. My observation was the kid was continuously taking rounds of his tricycle and enjoying, in spite the people moving around in the room. He was doing the stunts with the tricycle and enjoying. Here, we took the rubric amusement desire for. As we know, see, you can see in the picture also, the kid is enjoying whatever he is playing. He is deriving a pleasure from that. So that is the amusement. Next, what I saw was while riding his tricycle in a room, he used to come speedily towards the maid doing cleaning as if he was Dasher, but used to stop near her and laugh again and continue doing the same. Means maid is here, he used to come and stop near her, laugh, again go back, again come and do the same thing. He was repeatedly doing the same thing. Okay, so I was seeing him doing this, and also you remember when he came on the VCV, he started playing with the headphone and talking also, but main focus was on playing with the headphones. So here we took the rubric playful. Next, while on VC with his mother, he was on and off peeping on the phone. Like mummy ne bulaya tha. He didn't came again, but he used to come and see and funny faces. Like he used to jump his eyebrows with eyes, doing some funny things as to we should look towards him what he is doing now. So that is we took the rubric antics playing, because what happens in antic playing is the kid or the person he wants you to see him कुछ अतरंगी कुछ ऐसा बिहेवियर करेगा ताकि आप उसकी तरफ देखो, आपका ध्यान खींचने के लिए अटेंशन सीकिंग बिहेवियर. ठीक है, so that is antics playing. Next, from start of the VC till the end, he was continuously roaming and playing with his toys and the tricycle. Only when once his mom called him, he came on the VC. There also he started with playing with the earphones and just answered my two questions and again went back to his toys and tricycle and play. So here we took the rubric sitting aversion to sit. As whole time on the VC, I saw him playing and roaming around. Only for 2 minutes he came on the VC. Else I saw him playing in the room continuously till we were on the VC. Okay, so rubric sitting aversion to sit. So, and the mother gave us this information that whenever he used to fall ill, he just lies down without complaining, playing with his toys and watching cartoon. Okay. As soon as he feel better, his masti starts. So here what happened now? He became cautious as to now I'm ill, so I should take rest or I will not be able to play or get the amusement because uh, as soon as the fever gets down, he again starts playing at his energy. Now, in this, when fever is there, still he is playing. Still is playing, but energy is low. He is resting and still mildly seeing his cartoon and watching and playing with the toys. Okay. Now, throughout the case, the information obtained from his mother and aunt, it was seen that the mother was continuously restricting him to do the things, restricting him to eat, to how much to eat, comparing with him with other kids. है ना, उन्होंने बताया ना कि वो जो रिलेटिव्स आके बोलते थे कि ये दुबला पतला है एंड ऑल, तो उसके बाद तो उसकी मम्मी लाइक पीछे ही पड़ गई, ये खाओ वो खाओ, ये मत खेलो वो मत खेलो. तो स्टार्टेड कंपेयरिंग उसकी जितना हाइट नहीं है, वेट नहीं है. सो शी स्टार्टेड ना इनहिबिटिंग हिम या रिस्ट्रिक्शंस लाने लग गई. So here we took the rubric contradiction, intolerant of contradiction. You can see in the picture too that mother is instructing, but the kid is not liking it. Yes. Now let's just see the follow-up. See, this was the starting day in June last year, 2024. Mhm. This was 15 days after, and again 1 month after. Okay, so these are the three. And now, just before presenting the case, I asked her to send the photo as of how is he whole year. So she told that he has not been suffering from recurrent fever, cold, cough, anything, and the lymph node had subsided and had not relapsed. So no lymphadenopathy, no fever, no recurrent cough, cold, nothing since last 1 year. Okay, so this is a recent follow last month. So as many of you have already guessed, very simple case. And the remedy prescribed was, of course, none other than Lachesis mutum. Okay. This is our daily bread and butter remedy. So this was a rubric chart which we have discussed earlier. Amusement, desire for playful, antiques playing, sitting aversion to sit, desire for cautious, contradiction, intolerant of contradiction. So before proceeding now, I would just like to discuss few things related to case taking, especially every case taking it is important, but in today's case, like in this kid's case also, how important IPR was now. Now this pic is taken from Beginner Series Part 1 adaptation by Krishna Kumar Dinde sir. So, what he has written, a human being is continuously interacting and adapting with his environment to maintain his state of well being. For study's sake, the environment is divided into two parts, natural and artificial. So, natural environment covers climate, seasons, food, microorganisms, and the artificial will convert domestic, socio-cultural, religious, professional, and financial. So this domestic artificial environment is very, very important. In today's case also we have seen most of the information was given by them and the ailments were coming from IPR only. Okay. So there is a diagrammatic presentation also. See human being. So instead of human being, you just considered a 5-year-old boy, today's patient, and environment is his mother. Okay, mother, father, everyone staying at home. Okay, in this case, it was his mother. So there is an interaction between them. Okay, if the child has been adapted to the environment, then he would be in harmony and in health. But what happened? The child was not happy with the mother's interference or restrictions. So what happened? He could not adapt and he fell ill. Okay. So IPR is very, very important in every case taking. If we could not have been known about IPR, it would have been difficult. As in pediatric cases, IPR is of most importance. So, few keynotes from radar about Lachesis. There is an internal overstimulation seeking an outlet. And passionate, expressive, outgoing, intense, creative, vital, lively, constant overflowing of ideas. There is a loquacity which aggravate if sexual desire is suppressed. This is very, very important. Loquacity is aggravated if sexual desire is suppressed. Jumps from one subject to another. Attached to material values. Very possessive to things and persons. Envy, jealousy, suspicious, fear of being poisoned, dictatorial, selfish, doesn't want to be restricted. Okay, the important points from radar. So here now, it's given that very, very attached to material values and very possessive to things and persons. Why Lachesis is very possessive about the things and person is ना, वो जो भी करता है ना इतना अंदर घुस के करता है, बहुत ज्यादा इन्वॉल्व होता है किसी भी चीजों में. टॉय पसंद आ गया बच्चों में तो इतना पसंद आता है कि वो तो किसी के साथ शेयर नहीं करता. कोई चीज पसंद आ जाती है या फिर कोई आर्ट, किसी को क्रिकेट पसंद आता है तो वो बंदा इतना पैशनेटली वो चीज करता है कि वो अपने हर चीज के लिए इतना पजेसिव हो जाता है. पजेसिव कब होते हैं ना कि जिसमें हमारा इन्वॉल्वमेंट बहुत ज्यादा होता है. सो लैकेसिस में ये चीज है, बहुत पैशनेटली वो चीज इतना घुस के इतना इन्वॉल्व होके करता है ना कि उसका वो नेचर पॉजिटिव हो जाता है. Next, as you all know, Lachesis is proven by Dr. Constantine Hering. So let's see what he found in proving some important points and highlighted. Let's go through it. Extraordinary loquacity, making speeches in a very select pace, but jumping off to most heterogeneous subject at the same time. Full of mistrust, religious monomania, fear of being damned, insane jealousy, jealousy with frightful images, great tendency to mock, to satire and ridiculous ideas. Inclination to be communicative, is morbidly talkative and gives a rambling account of her complaints. Malice, thinks only of mischief, undertakes many things, perseveres in nothing. Perfect happiness and cheerfulness, followed by gradual fading of spirituality. Want of self control. Lascivious, felt as if was clear animal through, whilst all the mental power was dormant, sensation as if in hands of a stronger power, as if charmed, and as if she could not break the spell. Ailments from fright, disappointment, love, and jealousy. Dread of death, fears to go to bed, and fears of being poisoned. This was what Dr. Herring found while proving Lachesis. Okay, so we have few DDs. Lachesis is always being compared to these two remedies. Of course, one can be tuberculinum too. So let's see. The Lachesis is in communicative, even phosphorus is in, but belladonna is in secretive. Okay, so Lachesis is frivolous, belladonna is frivolous. Lachesis is in cautious, religious affections, bed aversion to shuns bed. Even Lachesis is in the rubric ambition increased, fame fall. Very, very curious. Activity desires activity, cares full of, magnetized desire to be. And here he's a boaster, soft for superior and hard for inferior, which is not there in phosphorus and belladonna. Okay. And phosphorus we see is very communicative. There is a rubric carried desire to be carried, light desire. Care is being desired to be is there in phosphorus, and bed desire to remaining. Phosphorus, there is bed desire to remaining. Okay. And in Lachesis, it is bed aversion. Then phosphorus, there is delusion, wealth. Activity, desire, activity, curious. Ambition, increase, fame for. See, Lachesis and phosphorus both are in ambition. But belladonna is not in ambition. Again, phosphorus, there is magnetized desire to be, cares full of, phosphorus in talking business of. There is no such any rubric of business in Lachesis. Phosphorus is again in the rubric delusion noble and hypocrisy. So belladonna is secretive, very, very naive, frivolous, credulous, is in the rubric light desire for. Now, belladonna is in the rubric ailments from ambition deceived. There is a rubric carry desire to be carried past in belladonna. Delusion, wealth. Noise, inclination to make noise. Talking, business of, and boaster. Okay. So I just wanted to add few things about lachesis. See, what happens, what I have saw in these pieces of lachesis is they are very high energy. There is a very high sexual energy, sexual drive in them. When this energy doesn't found its way out now, if it is repressed or suppressed and cannot find its way out, then these give symptoms physically or psychologically. Okay. So when this energy is cannot find its way and it is suppressed on the physical level, it gets uh, like it creates a sort of tension on both physical and mental level. So that tension has to be released in some way. So on physical level, how the tension should be released now? It should be released with discharges like menstrual discharges or excessive exercise, physical activity. He should get those way out. On a psychological level, this should be discharged through talking. That's why there is a loquacity. Okay. If it is not, then it will give symptoms. Lachesis will suffer. If this energy is not directed properly, then lachesis will suffer for sure. So lachesis is very, very passionate, very, very passionate. Whatever he does, he indulges in that activity, may it be singing, may it be any sport, any art activity, whatever he like, he does it passionately. He is 100% into that. For example, consider a kid seeing a cartoon and enjoying. So he is seeing the cartoon, but is enjoying in such a way that he is considering himself as one of a character. सो इतना उसका इन्वॉल्वमेंट होता है, इतना कुछ भी चीज इतना पैशनेटली करेगा ना, इसलिए वो पजेसिव में है. ओके. एक और थीम है जो लैकिसिस में बहुत बार देखा है कि दे आर नॉट यूज टू रेस्ट्रिक्शंस. रेस्ट्रिक्शंस उनको पसंद नहीं है किसी भी तरह से. जैसे ये केस में भी हमने देखा कि मदर की तरफ से इस बच्चे को बहुत रेस्ट्रिक्शंस आ रहे थे. सॉरी. रेस्ट्रिक्शन, इंटॉलरेंस ऑफ, ये लैकिसिस को रेस्ट्रिक्शंस बिल्कुल पसंद नहीं. अगर रेस्ट्रिक्शंस भी आते हैं तो सिम्टम्स आते हैं फिजिकल. और रेस्ट्रिक्शन कैसे, जैसे ना लाइकेसिस में फिजिकल लेवल पे टाइट क्लोथिंग अराउंड द नेक टॉलरेट नहीं होता है. ऑन फिजिकल लेवल दिस इज अ रेस्ट्रिक्शन. एंड साइकोलॉजिकल लेवल पे अगर जैसे अभी यहाँ पे मदर ने कोई रेस्ट्रिक्ट कर दिया या फॉर एग्जांपल कोई भी रेस्ट्रिक्शंस आते हैं, तो साइकोलॉजिकल लेवल पे व्हाट हैपेंस, ही गेट्स एंग्री, एंगर आ जाता है. ठीक है. तो अगर इसको रेस्ट्रिक्शंस आते हैं कहीं से, तो अगेन सिम्टम्स डेवलप होते हैं. ठीक है. यही से लैकेसिस कि ये एलिमेंट्स चालू होते हैं. So that's it. Any doubts? Dr. Mansi? Dr. Mansi? Any questions? Yeah, Mr. Jay, I have taken both the rubric. See, amusement desire में क्या होता है ना, वो उस चीज से ना प्लेजर लेता है. ही इज एंजॉयिंग इट। एंड प्लेफुल इज द थिंग कि वो उसको जो भी मिल जाए ना उसके साथ वो खेलने लगता है। ठीक है, दोनों रूब्रिक्स लिए हैं हमने इसमें। या डॉक्टर आशिया, why not belladonna? See, belladonna, see, I've already mentioned here, ये बच्चा कितना कम्युनिकेटिव था। ऑफ कोर्स ये डीडी रेमेडी में इसीलिए है। ठीक है। और इसको देखा आपने जब इसको, ये बीमार था, ठीक है, तभी ये आराम कर रहा था, आराम से चल रहा था, इसकी दवाई ले रहा था सब। बेलाडोना कैरी डिजायर टू बी कैरीड फास्ट में है, इतना पेशेंस नहीं रहता, इतनी दवाइयाँ बेलाडोना लेता ही नहीं, पहली बात। एनी क्वेश्चंस? डॉक्टर मानसी?
Hello. Yes, ma'am.
या,
So,
एनी
ma'am,
क्वेश्चन आई नीड टू आंसर?
so if anyone has the question, they can have in question and answer box. So, ma'am, Dr. Asha is saying, aimants from ambition, deceived, please explain.
सॉरी, आई एम नॉट एबल टू हियर। हेलो?
Hello. Yes, ma'am. Am I audible now?
या
So, ma'am, Dr. Dr. Arshia is saying, ailments from ambition deceived, please explain.
ailments from ambition deceived in belladonna, okay. See what happened now. In belladonna, what happens, belladonna is a light desire. So what does it mean by deceived is he just planned for a goal, but for some reason he cannot achieve that goal. That is ambition deceived. He sets a goal but could not achieve for any reason, might be for his own reason.
So, any other question? And my two participants are saying rubric liner.
Sorry,
So, ma'am, few participants are also saying,
your voice is breaking it.
hello.
Hello? Yeah.
So, ma'am, few participants are saying tuberculinum.
Yeah, very close to tuberculinum. But see, tuberculinum is very destructive, very destructive, having same energy as lachesis. But the difference is here the mother was very calm. अगर tuberculinum होता ना ये बच्चा, तो मदर भी उसके पीछे लग जाती कहीं उसको कुछ लग ना जाए, because I think tuberculinum is in the rubric danger, no sense of danger. तो लैकेसिस कॉशियस में है, वो खुद ही इतना ये नहीं करेगा, वो इतनी मस्ती कर रहा था ये कि मेड के पास जाके रुक रहा था, उसको पता है कहाँ रुकना है, कितनी मस्ती करनी है, ही इज वेरी कॉशियस। तो ये ट्यूबरक्लिन ट्यूबरक्लिन इज वेरी डिस्ट्रक्टिव, वो अपनी चीजें भी तोड़ फोड़ करता, टॉयज इधर उधर फेंकता, उसने ऐसा कुछ भी नहीं किया, राइट। Any questions again?
Yes, ma'am. Ma'am, they're asking what potency of Lachesis was given
Yeah,
and
yeah.
potential repetition
Yes.
for how much?
Yes. So when at the time of first consultation, I gave him Lachesis 1 m daily for 8 days. For 1 week, it was given. And after 15 days, I took that follow-up. The medicine was acting as we saw in the follow-up. Pick. Medicine was acting. After that, no repetition of medicine. Only with SL we have continued the case. Within 2 months, it was sorted. No repetition. Only 1 m, 8 days, OD.
So, ma'am, I guess we have done the case.
Okay. Hope I have answered all the questions.
Yes, ma'am, yes. And
If anything,
if
you can reach me out later.
surely, and this session will be also uploaded on the YouTube. As we all know, there you can also reach to Dr. Vishakha for any doubts. And ma'am, thank you so much for your valuable time and this
Thank you.
absolutely very knowledgeable and very insightful session.
Thank you so much. Thank you, Dr. Mansi. Thank you, each and every participant, for actively participating. Hope I have cleared all the doubts. If anything, you can reach out to me.
Sure, ma'am, sure.
Thank you.
Okay, ma'am. Thank you. Good night.
Yeah, good night.
Okay.